A fertility problem is considered when you've tried to conceive for at least 1 year and you have been unable to conceive. And if you fall into that category, then you need help. You need someone to assess the problem effectively and work out a plan.
I was diagnosed with stage 4 endometriosis in 2013, and then we started with fertility treatment in 2014.
The important thing is that you need to plan. I sometimes meet patients floating around for 3-4 years trying to conceive, not really having a set plan or strategy.
I think the hardest part was finding out that I have a condition that influences my fertility.
In vitro fertilization, IVF, that's normally done when there's no severe male factor infertility present. Then we just add 100,000 sperm to each egg that's found, and then the sperm must fertilize the egg on their own.
Usually a fertility problem is not only one single thing. There can be a male factor, there can be tubal factors. Even at the age of 25, up to 50% of the eggs that you produce is not viable to produce a pregnancy. And whilst men have millions of sperm, women only produce 1 egg in a natural cycle. You need to do a thorough assessment of the patient and her partner and then decide.
While you're doing fertility treatment, there's no certainty of what the outcome of it will be.
When you look at the studies, they quote 80% of people who enter a fertility treatment program will fall pregnant.
I conceived in 2014 after I realized that I needed fertility treatment. Then my baby was born in 2015.
Obviously people want to know about side effects and possible risks. This has been studied over and over again, and there's no increased risk in patients who have used fertility treatment for any cancer. With regards to the risk of multiple pregnancies, when you do IVF, obviously you decide how many embryos you transfer into the womb. And if you only transfer 1, you reduce the risk of multiples considerably, because obviously as you increase the number of embryos, you do increase the success rate as well. So you need to find a balance between risk of multiples versus the success rate.
I think other couples who start thinking about starting a family should, the moment that they expect anything is wrong, they should go to a fertility specialist and get both of them checked out. You should never lose hope, and it's definitely worth it in the end.